Hello, everyone. I'm delighted to be here with you today, virtually, but I'm actually on the Camino, Santiago, walking the line with cancer survivors. So we're living our best lives, doing our exercise in the Irish Cancer Prevention Network space. So the Marie Keating Foundation's commitment since the inception has been to make cancer less frightening by enlightening. And what a great space to be in when we're talking about this in social inclusion. With thanks to Deloitte, we have been enabled to put a strong focus on providing free education and support for women and men in underserved communities, namely traveller community groups around cancer prevention and early detection. Our overall plan was to provide cancer awareness in the form of presentations with leaflets, but also with videography. And I feel we've done that really well. If you visit our mariekeating.ie cancer services, you'll see all those kind of presentations and leaflets available in the space. So I suppose the next thing I'd like to really talk about in a little bit more detail is the actual focus group and the questionnaire that Pave Point and ourselves worked with together. And I'd like to thank Pave Point and the primary healthcare leads for working with us in this space. We've actually received some really valuable information. And one of these ladies was an actual breast cancer survivor, and 5 of them were actually engaged regularly with the screening program. So some of the themes that came from the focus group and the questionnaire were that the majority of traveller women and men are well aware of lifestyle choices and the increase of risks in cancer. But the challenge is raising awareness about noticing changes and going to regular screenings. Travellers associate cancer with death, really important for us to know that. And that's where a lot of fear and avoidance comes from. Along with that, embarrassment, along with fear, is another key reason travellers don't go for screenings. And they've told us many stories about people they know in their 50s who've never had screening. So our message really is, together with them, is to feel the fear and do it anyway. So primary healthcare workers think leaflets were the best way of providing this awareness while they're out on site in the sites with leaflets on board. They can actually start those conversations much easier. And I think that's really important. They also felt that the leaflets, together with social media content and a video, were a really good way of actually transferring that information to WhatsApps for younger men and women. Very important, again, to have the leaflets culturally sensitive, with plain English and with the colour coding that attracted them themselves. So again, they want to know about the different stages of cancer, and we know as well through the focus group that currently they receive a lot of their information from their mothers, from their fathers, from the primary healthcare leads, and sometimes from their GPs. So we really wanted to change that concept and that belief. And really what we wanted to recognise here was that they are really agents of their own health. They can positively impact their health by making healthy choices, being aware of their body, and attending screening. And the messages we really wanted to get across here were that cancer awareness needs to be communicated, that it is preventable, but also if it's caught early, it can be treated, and survivorship rates are up and death rates are dropping. Really important information that needed to be put across them. So our impact has been that we've been able to carry out all those presentations that I mentioned. So breast, cervical, ovarian, bowel, and prostate. We have the presentations, we have the leaflets, culturally sensitive, and we also have some fantastic videography invited into their homes to talk about these cancers and the fears that they had and have, and trying to disseminate some of those fears. So they're feeling the fear and doing it anyway. And we have had an indirect impact on over 5,000 people during this project within the Pave Point and traveller community groups. Really thankful for this space. And again, I would invite you to visit our website and make sure that people in marginalized communities and healthcare promoters are aware of these resources and we can use them. Thank you.